lot, but it does contribute to your assessment findings, and it also helps you become more adept using these tools, your fingers, your hands. So that's why we bring it in as an extra points to give you that opportunity. So you're looking at the posterior chest, and it's more or less in an hourglass format, so in and out to the sides. He's got a bigger chest than Ms. Jones does, so I'm thinking we're going to probably be able to assess all 12 sites on this patient in the front as well as in the back. So I would say we're going to do some percussion, Mr. Jones, and I'm going to try to avoid the bones. So I'm going to do the indirect percussion side to side, and we're looking at similar to inhalations and sites that you would put your stethoscope when you're listening. Lateral sites as well. I'm going to do this on the other side. In the interest of time, you know, you may not be able to do it all, but you try to do the best you can when you're demonstrating, even for the exam. And what you can't reach, then you would have to turn the patient over or whatever. So then with tactile fremitus, I recommend using the ulnar portions of your hand, and in some of the assessment textbooks you'll see where they recommend the palmar or the ulnar, and even this ridge. I've seen that being used too, but I think it's just a little easier just to go ahead and make fists and do it that way. So then you would put your fists on the areas within the scapula, again in an hourglass shape, and have the patient say 99, 99, 99. Now we can cover more areas, so maybe only 4 or 5 sites. 99. Okay? Any questions? Anything else you'd like me to demonstrate?
I have a question.
Yes.
Do we have to, like, can we, like, do the exam that's required and then at the end be like, oh, I have time, let me do extra credit? Can
Absolutely.
we do that? Okay, good.
No problem with that. That's fine. Other questions?
Do people usually go over, or, I mean, I know you went over because you're explaining things as you go,
Oh,
but
yeah,
do people
for sure.
normally finish within?
Yeah, they do. Yep. And then what you're going to do is practice, 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 and doing it will give you the confidence you need, so when you're standing in front of us doing it, you're going to be that much less nervous. Don't just try to memorize it off your paperwork, or you're driving down the car and you can, you're driving down to work order, you can recite it. Reciting is one thing, but actually doing it, and remembering to stand at this side and then that side and then synthesizing it. So really practice on each other, on your loved ones. Like I told you, even use pillows to simulate your patient, so you're doing the movements that you would need to do. It'll help you be successful.
Yeah, how many of you will be there? You keep saying us.
Well, you know, I was hoping I'd have some help with the instructors, but I don't think I will. So you're right, it's going to primarily be me. So you'll be signed up for your hour, you and your partner, and then I will just be assessing each group like that. If I have some instructors step forward and say, hey, I can help you out, then we would try to see if people would be willing to double up, so the 2 instructors can be in the room at the same time. But so far I haven't had any takers, so it'll just be me as far as I can tell.
And what's crepitus?
Crepitus. Who can tell us what is crepitus? It's a
Crackling and
crunching
crunching
sound,
joints.
right? With your joints, you might feel some crepitus or clicking. And then we also talk about crepitus in the tissue, which is a finding that is more advanced, but maybe you're having a patient on the ventilator and they start to develop this crepitus, air kind of tucks up under the skin. You can feel it like potato chips. It kind of feels crunchy. And that may be called crepitus. It's called subcutaneous crepitus, or emphysema is another, subcutaneous emphysema we call it, because the air is trapped. Just like in a person's chest with emphysema, the air is trapped. But crepitus we're referring to is the motion of the joint, in the joint.
And if it crackles?
If it crunches or grinds, anything like that, it would be considered abnormal or crepitus. Or you could describe it as a grinding or a clicking too. So, all right, any other questions?
Will we be doing the abdominal portion on a mannequin?
No.
Okay, so we're doing the whole thing.
On each other, right. And the reason I did that is just, revealing to the whole world here, so I just kind of use the mannequin. So, any Any other questions?
Yeah, what are we supposed to wear?
You'll be in your scrubs.
So the person is not gonna be in a gown.
No, they won't be in a gown, and then what will happen is many of the students do not feel comfortable with having their shirt pulled up and things like that, so then you just say, I would pull up the shirt and listen directly on the skin, or I would open the gown up and, visualize, but because of the privacy of your student, they may not feel comfortable doing that, and that's perfectly fine, but just verbalize it, okay? All right.
Also, on the documentation, I don't know if I misunderstood that, but are we supposed to do that prior to coming to class?
It'll come afterwards, after you've done your assessment, you'll have some time over here, you'll just kind of relocate. You'll finish your critical thinking question, which we're gonna go over some mock questions next week, so you know what those are like. You'll have an opportunity to draw out one system and document on one system, whatever your findings were, whatever you can remember your findings were. And so you would do it at that time. Does
And
that
did you
help?
say that we could bring like a little note card with?
You can bring a little note card for the exam.
Okay.
So you can refer to your cue card up to about 3 times, I think it is.
Oh, I thought we said 12.
No, look at your rubric.
I'm kidding.
So, yeah. Oh, yes, hundreds of times. But so hopefully that will help. Any questions?